Hi, my name is Rusty, the Living Donor Liver Transplant Nurse Coordinator at the University of Washington Medical Center. Today, I would like to discuss with you the benefits of living donor liver transplantation and how to pursue living donor transplant as a treatment option for you. When being diagnosed with end-stage liver disease, there are two treatment paths one can take. The first option is to decline transplant and participate in treatment of symptoms. This treatment can be done with your local medical team or a palliative care medicine team. The second option is liver transplant, either via deceased donor transplant or living donor liver transplant, or LDLT. While you are watching this video, you have already begun the process to receive a transplant. This video will explain the benefits of living donation and why it is the preferred route for transplant. It is important for you to become knowledgeable about liver transplant and your options so that you can advocate for yourself to receive the best treatment option that is right for you. With this comes knowing how living donation works. While our team will do the work of educating potential donors and recipients, it is important to have your own understanding so you can begin to feel comfortable looking for a living donor. In living donor liver transplant, a portion of liver is surgically removed from a healthy living donor and transplanted into the recipient once the diseased liver is removed. Living donor liver transplant is possible due to the liver's remarkable ability to regenerate or regrow in both the liver donor and the recipient. This regeneration is nearly complete by the third month after surgery, with the majority of regeneration being completed within 3 weeks of surgery. About 50% of living liver donors report a return to their normal life at 6 weeks, and almost all donors are fully recovered after 3 months from their surgery date. Unfortunately, with almost 13,000 people on the U.S. liver transplant waiting list, there are simply not enough donated livers for deceased donors, which means that not everyone on the waiting list will survive to receive a life-saving transplant. To help solve the deceased donor organ shortage challenge, family members, friends, and even strangers frequently inquire about the option of doing a transplant with a living liver donor. The transplant team at the University of Washington Medical Center is the only group in the Pacific Northwest performing liver transplants in this innovative manner, referred to as living donor liver transplant, or LDLT. Our team performs this surgery in both adults and children who are in need of a liver transplant. While both deceased donors and living donor transplant are excellent treatment options, living donor offers better outcomes. Another major benefit to living donation is that it can reduce the waiting time for a liver. The shorter wait time allows the recipient of the liver to be transplanted before they become critically ill. Living donor liver transplant also allows for planning of the surgery date, which allows families to prepare for the liver transplant. Also, because the liver donor is healthy at the time of donation, the liver quality is excellent. All of the above and pre-donation evaluation allows for better overall outcomes. Also, because the liver donor is healthy at the time of donation, the liver quality is excellent. In addition, the use of a living donor liver transplant organ saves 2 lives. Another patient can receive a deceased donor's liver offer that would have previously not been available to them. Recipients who have a living donor liver transplant seem to have fewer medical problems after the procedure than those who receive a liver from a deceased donor. And as you can see from the red line within this graph, a liver from a living donor also has a slightly longer survival rate. Almost any healthy person can be a donor. They can be a different race, sex, age, blood type, and even live in a different country. It is not your job to figure out if a potential donor is healthy enough or even blood type compatible. This is what our team is for. Our basic criteria includes that they remain generally healthy, do not have a BMI of greater than 30, are between ages 18 and 60, and are interested in donating of their own free will without pressure or coercion. If a person lets you know they are interested, please encourage them to apply to be a living donor liver transplant donor. Our team is conservative on health status requirements to ensure we are never putting the donor at undue risk. So now you have learned some information about the living donation process. The next step is how to pursue your opportunity to be a living donor. We know at the University of Washington Medical Center that the idea of asking someone to donate a part of their liver can be uncomfortable. This fear often limits many from pursuing it. So how do you find a living donor? Instead of asking right away, start by sharing your story. Many living donors say they decided to donate after hearing someone's story. An additional support is to find a living donor champion. This is someone that you ask to be your advocate in getting your story out there. Finding a suitable living liver donor is not always easy. A liver donor champion is someone who knows and cares about the transplant candidate, who perhaps cannot be a donor himself or herself, but who wants to help the patient. The liver donor champion is willing and eager to learn and volunteers to serve as an advocate on the patient's behalf. The University of Washington Living Donor Team educates the donor champion on liver disease, transplantation, and provides tips on being an effective spokesperson for the patient. The liver donor champion spreads the word about their loved one's need for a liver transplant and about how living liver donation saves lives. Liver donor champions reach out to family, friends, and acquaintances to advocate for the liver patient through social media, email, phone, videos, letters, etc. If you clearly tell your story, others will know that you need a liver for transplant. Begin by discussing why the transplant is needed, how the transplant will help, problems that occur with your liver disease. Also talk about patient's current physical state, how the need arose, expected wait time, benefits of living donation. Explain that most healthy people can donate. Make it clear that you are not asking for an answer right away. Tell them donors can change their mind at any time. Sharing the why and how of your story moves people to understand the importance of donation and how detrimental end-stage liver disease is on maintaining a normal life. Once you have identified what you would like to say, the next step is deciding where to say it. There are many avenues for you or your living donor champion to share your story. Feel free to cast a wide net. When sharing through outlets that are not face-to-face, it allows for potential donors to read and process on their own time and make the decision independently. It is important that the decision to donate be voluntary, so the potential liver donor must initiate the process. No member of the University of Washington Medical Center Living Donor Liver Transplant team will contact a potential donor initially. Once we get started, our team will provide you with an independent living donor advocate who will support you from start to finish. Your advocate is available to answer any questions, explain the risk and rewards, and voice any of your concerns to the liver transplant team. Our team can easily make a template for your specific recipient. You can post this template on any social media sites. Lastly, it is important to know where to direct donors to. Our team will never initiate contact with a donor to protect their anonymity, so it is important that anyone interested can contact our team directly. You may include our website, phone number, or this QR code on anything you'd like to share to help increase donation support. For any further questions, please refer to our website or contact the Living Donor team or your pre-transplant coordinator. Thank you for your time and your interest in learning about how living donation can be an option for you.